The Erie County Sheriff's Office is out from under the thumb of the Federal Justice Department oversight. That ended last summer once the agency was able to improve conditions in both the holding center downtown and the correctional facility in Alden.
Now the agency is seeking national accreditation, which jail administrators say will keep them moving in the right direction. Luke Moretti reports.
We're always reviewing our current procedures, always looking on how we can improve.
That's Michael Phillips, Superintendent of Jail Management for the Erie County Sheriff's Office. He says the agency, under the leadership of Sheriff John Garcia, is in the process of becoming nationally accredited.
Part of the accreditation is the self-audits.
The National Commission on Correctional Health Care and the American Correctional Association are the two organizations being pursued by the Sheriff's Office.
And I believe the accreditations last for 4 years, is it?
3.
3 years.
Okay.
So every 3 years they come back and, we'd have to show that we're in compliance with everything again.
Sandra Amoya is the first Deputy Superintendent for Compliance in the Jail Management Division.
Who's going to audit us? Who's going to make sure that we stay on a path that's the right path?
She says that's precisely what Sheriff Garcia wanted to know, which led to a real desire to seek national accreditation. Amoya considers the American Correctional Association the gold standard.
There's over 400 standards that we have to comply with in order to get this accreditation, and we're looking at May of 2025 to have our audit. The NCCHC, which is medical and forensic portion of national standards, we're looking at having our final focus survey done in April of this year.
According to its website, the National Commission on Correctional Health Care uses external peer review to determine whether a facility meets the relevant standards. Audits by the American Correctional Association cover administration and management, the physical plant, institutional operations and services, and inmate programs.
Those are the gold standards, national accreditations that we're striving for. We're on our way.
On top of that, a needs assessment study has been underway for about a month.
That is really going to take a comprehensive look at not just the jail system, but the criminal justice system as a whole, and chart a course forward to take us into the next century in terms of public safety and incarceration.
Thomas Dina, Chief of Community Reintegration, says a new jail facility designed to meet today's emerging mental health challenges is on the wish list. In some circles, the existing facilities, the holding center downtown and the correctional facility in Alden, are considered dinosaurs compared to today's modern jails.
A linear-style jail built in 1938 was not built in consideration of these issues. It was built as a maximum security facility designed to keep people inside.
Over the past year, Jail Management Division staff has toured several modern correctional facilities in places like Cook County, Illinois, Franklin County, Ohio, and Onondaga County in central New York.
Natural light, softer colors, access to programming, technology, therapeutic spaces, things that were never considered when I started with the Sheriff's Office, are really becoming the norm in modern facilities today.
I think that the modern facilities that are being built today are built with mental health in mind. They're built with brighter colors, softer colors, skylights are in the facilities. Even the staff, instead of looking at a steel door all day, you're looking at a nice wooden door. The waiting areas is just, you can feel it. It's hard to put into words, but the way they're designed, it's just a brighter, more cheery place.
Erie County's needs assessment study is expected to take several months and include input from law enforcement as well as other community stakeholders, eventually mapping out the next steps.
I mean, we're not going to prejudge the outcome of the needs assessment, but from all of us working in the buildings, it's time. These buildings need to be replaced.
There's something else on the wish list, more beds to treat forensic mental health cases, not at the jail, but at a Buffalo hospital. Jail administrators say there's a waiting list because there just aren't enough beds to meet the need. More on that in our next report. Luke Moretti, News 4.